Overactive bladder is actually a very generalized term, but it applies to you when your bladder gets in the way of your lifestyle. If you're finding that you're urinating too frequently and too often, that is considered an overactive bladder.
So overactive bladder is a very, very common problem. I see this very often in my practice. This is something that a lot of patients deal with and sometimes are afraid to bring up just because they think it might be just a part of getting older. And it is unfortunately not just a normal part of aging. This is something that we see very frequently and has good treatment options.
There are many different causes for OAB that can happen throughout any stage of life. If you have OAB, your doctor will talk to you and the two of you will help decide what is your cause of OAB.
So overactive bladder is typically diagnosed by symptoms and clinically when we have a discussion there in the office. There's other ways to diagnose it too, both clinically and with different tests, sometimes using a different bladder study called urodynamics, where we can evaluate the bladder and see if it truly is having these overactive contractions of the bladder. But typically we do it based on patient symptoms.
In a few causes and instances, OAB can be prevented or at least deterred, but most causes of OAB are not anything that you did right or wrong, it's just there.
So there's many benefits, I think, to coming to see a specialist for overactive bladder. I think one of the main benefits is we're able to cater a treatment pathway that focuses directly on you, the patient, and how we can make your life better. And that can be ranging from medications to other therapies or different, potentially even procedures that can help control the symptoms better.
When you first come to the doctor's office with overactive bladder, a discussion will take place, possibly some medication trials, and then a very brief and simple workup to determine what your causes and best pathway to treatment will be.
For each patient, the treatment plan can be fairly different, meaning not every exact treatment is going to work perfect for each patient. Every patient is going to require maybe something slightly different. So I certainly work close with my patients to see which treatment is providing the best overall results. And that can be both by the patient telling me their symptoms. We sometimes have you keep track of a voiding diary and where you log your different symptoms and how often you're having this trouble. And we move along as we're going after we've seen how these symptoms are treated with that type of therapy, and we can move on and progress to things as we need. And so I work closely with the patients to make sure that we're getting the best therapy that can work for that patient.
The satisfaction rates for overactive bladder treatments are actually extremely high. Nothing's 100%, but with all of the options that we can offer to all of our patients, our satisfaction rates are extremely high.
Overactive bladder can cause a lot of problems in someone's life. It's not just having to rush to the bathroom often. This can cause some pretty significant mental strain on your daily life. This isn't just something that as my patients get older that they just have to deal with. These are things that even my younger patients deal with. These are things that we can get better control. Some of these long-term consequences can even be not getting good night's sleep because you're waking up so routinely to go to the restroom, having to know where every bathroom is on the trip to work. These are things that we can get improved by talking here with a specialist and offering these different treatment options that we've discussed.
My main message to anybody watching this with overactive bladder is that you do not have to live with this. Please seek your options, seek a professional, but learn out how you can stop living life with your overactive bladder.